So I'm going to switch gears a little bit and talk about pediatric healthcare. So I work for Nemours Children's Health System. We are have two freestanding children's hospitals. We have one in Wilmington, Delaware that's been there since the 30s, and we just built a new one in Orlando and opened those doors in October 12. We have about 90 clinical locations crossing 5 different states. We also have a digital doorfront, if you will, and our digital platform is Nemours Care Connect. That is our entire telehealth program, and we started that back in around 2014, and really kind of have two arms per se. So we have built a 24/7 on-demand service, which I'll talk about a little bit more here in a minute, completely dedicated to pediatrics. And then we also have been utilizing telehealth technology within our specialty care practices across the various sites. We're providing that care using technology into the home. We're working with Nemours and non-Nemours primary care offices. Our whole goal is really to take the care where the patients are. It's hard to get to specialists. We are not usually in rural areas, and so if we can help and meet those needs of patients, keeping the medical home intact with primary care physicians, that is our goal. We're also working with healthcare partners, with various hospital systems, and also began working in schools last year. So our 24/7 on-demand program, when we kind of first ventured into this to say, wow, can we meet parents in their home? They have so many questions. They end up in our emergency room all the time. We went out to look on how we could develop this and realized at that point in time in 2015, there wasn't really a pediatric system that was providing 24/7 on-demand care in the home. So we decided we're going to build one. So we now have Nemours employed pediatricians. This is what they do full time. They provide care. They actually get to work from their home, which is a nice benefit for them. We now provide care in 6 different states. Through the platform, we have real-time eligibility, so it's fantastic with like Medicaid providers. We can actually ping the insurance and come back with that 0 copay or the appropriate copay for that patient. Of course, we can do electronic prescriptions. We can invite multiple parties to the visit. So we actually had a teenager, age 17, who called into the platform. The physician said, you're under the age of 18. We need a parent or guardian. He said, hold on a second. I'm at my grandfather's right now, but I'll call my dad. So he called his dad and said, hey, Dad, we're going to send you a link. You need to click on it from your phone so you can consent to this visit. So sure enough, Dad comes on the line, he consents to the visit, and the teenager is able to be seen in this kind of 3-way call. And what's great is the teenager found us. So that says a lot about where our young millennials and our young generations are today and thinking about healthcare. One of the other things that we do with our 24/7 on-demand program is we really want to keep the medical home intact. So we go to great lengths to obtain the primary care physician, their information if we don't already have it, so that we can also send a record to alert that primary care physician that we saw your patient, this is what we saw, and we're referring that patient back to their PCP to keep that medical home intact. We also have kidshealth.org. We're kind of a leader in pediatric healthcare instructions and information. We get about 1 million visits a day per that website. So we're also providing that discharge instruction to the parent for good education. Again, really rounding out that visit, right? Not just providing a prescription, but also providing that education. These are some of the conditions we treat, so I won't spend a lot of time on that. But I do want to spend a few moments here. So we've been doing this since 2015. We've seen thousands and thousands of children. We continue to see a very high user rating. So 94% of patients who rate us gave us 5 stars. We think that's pretty good. Wait times are under 5 minutes. And when you look at this graph here, I know it's a little bit small, but in that yellow bucket of parents at the very end of a visit, we ask them, where would you have gone had you not had this visit today? 26% say they would have gone to an emergency room. When we look at this compared to our adult counterparts, this is a really high percentage. Typically, it's around 4 to 6%. So if you begin to think about the cost associated with this, our physicians did some research on their first 1,000 visits, and they produced it. We looked at Florida. The Agency for Healthcare of Administration produces an ER utilization report each and every year. So we began to look at the really high utilizers of the ER are children under the age of 5. There was about 520,000 low acuity, so that's kind of like level 1, 2, 3 emergency room visits in the state of Florida. When we multiply that times $909, which is the average cost, again, this is low acuity, this isn't getting into the higher acuity, there's the opportunity to save upwards of $113 million in the state of Florida. Just think what we could do with those dollars instead of treating kids who probably could be seen somewhere else in some other modality. So I think there's a lot of opportunity there. So I talked a little bit about telehealth specialty care offerings. So these are some of the specialties we have begun to offer telemedicine in. Primarily it's with our current patients. That's where our physicians felt most comfortable in the beginning, but they're beginning to open that up to new patients as well. The whole goal of this is around creating value for our patients and families. We got to think about their drive time, their cost to travel. How do we increase specialty care into areas where they may have to drive 2, 3, 4 hours in order to get to us? How can they potentially be seen sooner, and how do we improve the patient experience? We actually did a pilot with Press Ganey. A lot of health systems, you guys are probably familiar, utilize this to compare and benchmark health systems, compare and benchmark themselves against other health systems in regards to patient experience. Our experience with the telehealth service came back where we ended up in the 95th percentile. That's really not with doing anything. So we think this area has a lot of opportunity from a patient experience standpoint. So I want to talk a little bit, and you see a picture here of Dr. Atunda. He is one of our orthopedics up in Delaware, and he runs a sports medicine program there. He is a big proponent of telemedicine and is using it all the time. So he said, you know, let's do a study. Let's compare what an in-person visit is like for our patients from a cost perspective and a time perspective compared to a telemedicine visit. Telemedicine visit is significantly shorter in time length. And when you look at the percentage of time that a physician spends with the patient at a telemedicine visit, it's 88% versus 15% in an in-person. We actually saved an average $24 in labor cost associated with each visit. And the parents, because they travel an average of 85 miles, this cohort, saved $50 in travel cost and had very high patient satisfaction. So we think there's tons of opportunity, and we're beginning to study this with other specialties and really begin to look at where that opportunity, not from just a cost savings from a health system, but really from a consumer perspective as well. So we're also providing school-based telehealth. I talked a little bit about that earlier. We're currently active in 4 schools and 1 child care center. We're getting ready to grow that this year, so we're looking forward to that. And we actually worked with the Children's Partnership, the Winter Park Health Foundation, and developed a roadmap for action for school-based telehealth. So you can access this roadmap at movinghealthcareupstream.org. It's there. There's a lot of institutions across the United States who participate in it. So it has a lot of great, valuable information on how to lift a school-based telehealth program. So what's next? So we're beginning to enhance what we can do in the home. I think somebody earlier today mentioned a company called TytoCare. We are also partnering with them and very excited about some of this technology that will allow us to look into ears, listen to heart and lung sounds. So not only in kind of that urgent care scenario, but how are we dealing with our medically complex patients, and how can we further the care that we deliver into the home? We are also deploying a remote monitoring pilots, one in particular around hypertension. And then we are doing something, I think, a little bit unique in the fact that we are now in the process of integrating not only telemedicine, but all of our digital assets into one digital portal. So that doesn't mean that we're recreating the wheel, a new EMR, a new online scheduling capabilities, a new telemedicine portal, but really kind of wrapping a digital wrapper around it so that we can begin to deliver one portal to our patients and families to hopefully make this consumer experience a little easier. So this is our Nemours app. Basically, we did some consumer research before we started this, and we learned that number one, parents want to access their children's healthcare record, right? They want all of that at the tip of their fingertips. They want the ability to schedule in-office visits. They don't want to necessarily have to call and make that appointment. They would love to be able to go ahead and schedule that online. They would like tools to track their children's conditions, such as asthma or diabetes, which we're in the process of developing today. And then the ability to access a physician, and hopefully their own physician. So that is all I have. Thank you very much. And I don't know if we're taking questions now or waiting. Yeah? Okay. Thank you.
Hi. As one of the early adopters for telemedicine with pediatrics, you probably had to really convince parents to give it a try. So what did you find to be your most effective marketing strategy in getting them to go to that first session?
That's a great question. So educate, educate, educate. So I think we've tried just about every means under the sun, and we're still exploring that. But social media has been key, digital interaction has been huge, and integration with our current other care delivery. So through primary care, through kidshealth.org, there's nothing like having your pediatrician let you know that, hey, we have a whole group of pediatricians online, on demand. So that has really been instrumental in the lift of this program. Yes?
How do you handle your patients for, let's say, pulmonary? And after doing asthma education, you find that they're not using the proper space or technique. How would you approach that situation if the appointment was done via telemedicine?
So a lot of different ways. So we have some great, through Kids Health, has some great instructions, but we also have instructional videos. So through the portal, we actually prescribe the videos so that it educates the parent. And they can basically do that on demand whenever. So either through the patient portal, through messaging the patient, and then those videos and additional instructions, because there's nothing like watching it to learn how to do it. Yep. Yes.
Is your portal available for third-party use, like third-party API integration?
No, not yet, but I think we're considering that opportunity. Yep.
I'm curious, I mean, you talked about the 24/7 physicians that they work at home,
Yeah.
And then you also had the subspecialists. Was that a different panel of physicians, or is that part of the same panel, or how do you kind of
Great, yeah, great question. No, the 24/7, I almost consider them as like their own service line. So it's a group of about 7 or 8 physicians. Some do it part-time, some full-time, and they can do it from home. And then our specialists use the same platform. We have some that do some of that from home, so the evenings might be a little bit more convenient for their patients, so they have that flexibility to do it from their house as well.
And have the subspecialists, have they also bought into this, or do you have some that have come along and some still?
It's a great question. Yeah, I'd say we have our camp of champions who have really taken it and run with it, and then we have the second group who's kind of in the middle, that they were waiting for the champions to do it first. And then we have a group that's like, there is no way I'm going to retire before this. I'm going to do this. You can't make me do it. So we definitely have a wide array. Mm-hmm. Yeah.
So how are you billing the patients, and also what is the cost analysis of this model at the end of year to the practice, you know?
Yeah, so good question. So it's expensive to lift, right, to do it, and especially to invest. So the 24/7 on-demand team, we invested in a group of physicians because we believed that pediatric care, we should develop the protocols, the right way to do it. There are certain things that should be seen and certain things that shouldn't be seen. But we do believe this is the wave of the future. We are integrating that with our primary care, our urgent care, and our emergency room care. So some patients pay by cash. That's kind of the way we started that program. But now in different states, insurers are coming along, so we're having a lot of conversations with payers about setting up on-demand service, and then they're beginning to incorporate it. Say in the state of Delaware, there's actually reimbursement parity. So we are able to charge the patient their normal copay, whatever that may be, and we can deliver the service in this fee-for-service environment and get paid for it, which is nice.
Can we have a last question?
Yes,
Yeah.
very good case. Do you have any data for the patient, particularly for the pediatric patient children, the complaint or maybe dissatisfaction, any improvement?
Oh, so do we have, yeah. So yeah, we've gotten tidbits, and we're constantly listening through our surveys to our patients and families. I think the biggest hiccup sometimes is when they're in their home and they're like, it's not, my connectivity's not good. And we're like, you have one bar. Let's try somewhere else. So that's really tends to be the biggest complaint. Overwhelmingly, we see 96, 97, 99% satisfaction with the service. It's making it a little bit easy for them to get the care that they need.
Thank you so much.
Thank you so
Carey.
much.
Thank you.